HIV myths versus facts. What are HIV common myths? It is impossible to transmit or contract AIDS, which is advanced or stage 3 HIV. However, there are so many myths about HIV transmission, but exposing them can give people a better and clear understanding of what precautions to take and when to consult a doctor. In this video, let's take a look at some common misconceptions about HIV transmission. It is important to remember that undergoing HIV treatment reduces the risk that a person can transmit such a fatal virus to someone else. Before we begin to share, please subscribe to our channel and hit the notifications icon so you never miss out on our videos. Myth number 1. If I or my partner are HIV positive, we will never have babies. In fact, HIV-infected women are fertile and they can have children. If mothers and their babies take the proper medication, it's possible for HIV-positive women to have HIV-negative babies. Please remember that without using drugs, there is a 30% chance that infected women will pass the virus onto their babies in the womb, during birth or by breastfeeding. However, if the mother and baby, or even just one of them, use short courses of ARV, mostly nevirapine, and AZT, transmission rates can significantly be reduced. Myth number 2. My partner and I both are HIV positive, there's no reason for us to practice safe sexual relationships? No. You must practice safety measures while developing close physical relation. You may still be susceptible to contracting drug-resistant strains of HIV. Two HIV-positive partners could have different strains of the virus. If they have unprotected close physical relations, they could infect each other with another strain, leading to their immune systems being attacked by two different forms of the virus. This could weaken their immune systems further and might require a change to their treatment, as different HIV strains require different drugs. Myth number 3. I cannot be cured of HIV if I've developed a close physical relationship with a virgin. Developing a close physical relationship with a virgin does not cure HIV. Close physical contact, whether with a virgin or non-virgin, is the primary manner in which HIV is spread. It will only pass the virus to the virgin who may or may not be HIV negative. Myth number 4. I am taking treatment, I can't spread the HIV virus. Research shows when HIV treatments work well, help in reducing the amount of virus in your blood to a level so low that it doesn't show up in blood tests. Nevertheless, the virus is still hidden in other areas of the body. It is still important to practice safe relationships so you won't make someone else become HIV positive. Myth number 5. I am HIV positive, my life is over. No. Your life is not over. In the early years of the disease epidemic, the death rate from AIDS was extremely high, and one's lifespan was extremely short. But now, antiretroviral drugs allow HIV-positive people and even those with AIDS to live much longer, normal, and productive lives. Myth number 6. I can get HIV from insects like mosquitoes and pets? No, as HIV is spread through blood or bodily fluids. According to several studies, people are worried that biting or blood-sucking insects might spread HIV. There is no evidence to support this, even in areas with lots of mosquitoes and cases of HIV. You need to know that when insects bite, they do not re-inject the blood of the person or animal they have last bitten. Also, the HIV virus lives for only a short time inside an insect. So you cannot get HIV from insects and animals. Myth number 7. I can get HIV by being around people who are HIV positive. No, the evidence shows the HIV virus does not spread through touch, tears, sweat, or saliva. You cannot catch HIV by breathing the same air with someone who is HIV positive, touching a doorknob handle, using the same toilet seat after an HIV positive person, drinking from a water fountain, hugging, kissing or shaking hands with an HIV-infected person, sharing eating utensils with an HIV positive person, using exercise equipment at a gym. Myth number 8. Male circumcision prevents HIV? In fact, male circumcision does not prevent HIV infection, it only reduces the likelihood of infection. Several studies have shown that male circumcision decreases a man's risk by up to 60%. These results have led the government to embark on a campaign to provide free male circumcision services. Myth number 9. Traditional medicines can cure HIV. As you know that HIV and AIDS can cause various symptoms, and some alternative treatments could help in providing relief. Traditional medicines have not been experientially proven to cure HIV. There may be some herbs that could reduce symptoms of HIV opportunistic infections. However, to date, there is no cure for HIV. Myth number 10. Blood transfusions raise the risk of HIV. Doctors in the United States and many other developed countries rigorously test the blood supply for a variety of blood-related conditions, including HIV. Banked blood that is usually available for transfusion does not contain HIV. A person also cannot contract HIV from organ and tissue donations, as these have also undergone testing. When scientists first identified HIV, they recognized the symptoms of the condition but did not know what virus caused it. So, therefore, they did not test donated blood for HIV. Myth number 11. A person cannot contract HIV from an old or used needle. The HIV virus can survive in a needle for up to 42 days. There is no safe way to share needles. A person must use new needles each time they inject themselves with prescription or recreational drugs. You must also ensure that a tattooist always uses fresh needles before getting a tattoo. Myth number 12. Someone can contract the virus from touching HIV person. No, people cannot transmit or contract HIV simply by touching. Shaking hands, hugging, high-fiving, or other types of social contact will not transmit the virus. The virus can only be transmitted through bodily fluids like blood, breast milk, and other fluids during lovemaking. Myth number 13. A person can contract HIV from infected water. A study published on November 28, 2018. The HIV virus cannot survive in water. So, therefore, a person cannot contract the virus from drinking, swimming, bathing, or other activities involving water. Also, a person cannot contract HIV from saliva, sweat, or tears of a person with HIV, providing these water-based components do not have blood in them. Myth number 14. AIDS is a death sentence? In the early days of the epidemic, most people progressed to AIDS, the advanced form of the disease, and then died of it. Now anti-HIV drugs have helped many people live with HIV for years, often even decades. Myth number 15. Condoms provide 100% protection against HIV transmission. Laboratory testing shows that condoms are impervious to viruses, but protection rates are lower in real-world studies. Condoms can only protect against HIV and other sexually transmitted infections if used correctly. Protection rates can be significantly improved by combining condoms with other forms of prevention. Please remember that AIDS cannot be transmitted, but HIV is transmittable. However, there are many treatments available to help prevent HIV from progressing to AIDS. If anyone concerned that they may have HIV or face exposure to the virus may wish to speak to a doctor about testing. By dispelling myths about HIV and AIDS, more people can seek diagnosis and treatment earlier and lead long, healthy lives. How about you? Have you changed your mind? Would you still avoid sharing food, drinks, swimming pools and towels with HIV-positive person? Please type your answer in yes or no in the comments section below. I hope that you liked this video. Please share this information to the maximum people. If you haven't subscribed to our channel Health Experts, please subscribe right away so you may never miss out on our informative videos.